So I'm going to talk today about partnerships in the context of a large research study and about some of the strategies that we've been putting in place trying to get partnerships to work in this context. I'm going to first just briefly describe the study to you and then talk about the partnerships. So the study, HPTN 071, which is also called PopART, is a study that is trying to test out the hypothesis that universal voluntary HIV testing with appropriate combination prevention offered to all those who test HIV negative and immediate antiretroviral therapy for all those who test HIV positive would have a substantial impact on HIV incidence at population level. The study is a 3-arm cluster randomized trial of 21 communities in Zambia and the Western Cape of South Africa as well. And it covers a population of about 1.2 million people, so a very large cluster randomized trial. And in this trial, we are comparing an intervention of universal HIV testing with combination prevention, including immediate treatment in one arm, the package of universal testing and combination prevention, but with treatment at national guidelines in the middle arm, and a control arm of the current standard of care, which involves HIV counselling and testing being offered in various sites in the community and treatment, obviously, at national guidelines. This is where the study is being conducted. In Zambia, it's being conducted in 12 sites, which are along the line of road and rail from the Copper Belt down to Livingstone in the south, which is the area of the country that has the highest HIV prevalence and incidence. And in South Africa, there are 9 sites in the Western Cape province, either in the city of Cape Town or in the Winelands region. And this is just a graphic that shows the intervention that is being put in place in this study. So the intervention revolves around the universal HIV counselling and testing. And this is being primarily delivered by a cadre of individuals who we call community HIV providers, who come from the communities where they work and provide the option for annual testing for the entire community, really delivered by a door-to-door package with service promotion and referrals into the routine healthcare facility. So this involves not special study clinics, but the government-run primary healthcare clinics in the communities, and also other services such as voluntary male medical circumcision being conducted again by government or other implementing partners in those same communities. So what is this study teaching us about partnerships? Well, this study is really a very huge community randomized trial. As I say, it involves more than 1 million participants, 21 distinct communities, 8 district health authorities, 5 provincial health authorities, 4 ministries or departments of health, either national or provincial in the case of South Africa, 3 US government agencies, more than 6 PEPFAR implementing partners, as well as a study team of more than 800. And so partnerships are really very vital here, not only between all of the people directly involved, but also with policymakers, so that when we do find out information, we can make sure that it's actually put into practice. I want to start off with some of the partnerships, which start really from even the funding of this study. This study is primarily funded by PEPFAR, who are not a traditional funding agency for research. And PEPFAR is funding the research via the NIH. But in addition to this, much of the funding comes from different NIH institutions and also the Bill and Melinda Gates Foundation. And all of this funding is channeled through different funding networks, the HIV Prevention Trials Network, and also 3IE, to the researchers both in London and also on the ground in Zambia. But in addition, there's a huge amount of funding that comes for the implementation of this study. And that funding also comes from PEPFAR, but comes through to other US government agencies, CDC and USAID, to their respective PEPFAR implementing partners. And so this then means that all of these partners need to really work together and in synchrony to ensure that the implementation is being delivered at community level and that the research can be conducted properly. And of course, underpinning all of this are the national ministries of health, and in Zambia we have a Ministry of Health and the Ministry of Community Development, Mother and Child Health, both of whom are intricately involved in the research. So coordination between all of these partners is vital, and to try to make sure we are coordinated, we've ended up trying to design structures at all levels where we can make sure we have good communication and make sure the implementation and research go ahead together. And this is again just a diagram trying to demonstrate this, both for Zambia and South Africa, with the multitude of different structures that we've had to set up to try to ensure that everybody is talking to each other. Most importantly are the individuals and the structures at the bottom of this diagram, which are the people who are really on the ground. The staff in the communities, in the districts, the community advisory boards, the implementing partners on the ground, and the Ministry of Health staff, all of whom have to work together to implement this very ambitious study. And they meet at district level on a monthly basis. And each of those district level meetings feed up to a national level meeting where there's all the national implementing partners, community advisory boards, community members. We also have a trial management committee in each country. And this committee is in Zambia, is chaired by the Ministry of Health, and has representation from WHO, UNAIDS in country, CDC, USAID, PEPFAR, civil society, and community, again to ensure that everybody, community and policymakers and implementers, are involved at every stage of the study so that they understand what's going on and they can also advise and change what's going on if it's not going well. But key, I think, to all of the work that we do is our relationship and our partnership with community. And I think for this type of study, we struggle a little bit with what is community. We have 21 communities that are the clusters in this trial, and these are the geographic catchment area of one health facility. But in reality, these aren't necessarily a community. Often they're made up of multiple different communities of people who happen to live in that geographic area. And also they may be part of other communities which extend beyond the geographic catchment area. And so that's quite challenging. We also, of course, have communities of people living with HIV. And how do they fit into the trial communities and into this study? And then I think we also have communities of health implementers. We have the government health providers, we have NGO health providers, community-based organizations, and many faith-based organizations, all working in these same communities and in these same areas. And we need to try to ensure that all communities can come together. So again, this is another diagram just showing our attempt at community engagement and structures, where we have set up a community advisory board in each of the 21 communities, which has representation from community-based organizations, community stakeholders, and opinion leaders and gatekeepers. And each of these community advisory boards feed into national community advisory boards. And in addition, we've set up what we call Community Partners Platform, which is really representation of all of the different organizations at national level of people living with HIV and other interested community partners. So dynamism. The partnerships evolve, and I think we've, over the course of this study has actually only just got into the field. It got into the field in January of this year, but we first started having discussions with partnerships and the communities and the national health authorities several years prior to this trial being funded, and certainly very much before the development of the proposal so that we could incorporate views. I think what we've learned is that some partnerships develop more slowly than others. Some are quite natural, but some need to be worked at quite hard. And I think we're seeing changing relationships already as the trial progresses. And I think as we go further with this study, we will find these partnerships need to change even more. I think we're also learning that we may not all be natural partners. We all communicate with each other in English, but I think there are many different types of English and we often don't understand each other very well. We have different cultures and different skills and different education and socioeconomic status, and this also leads to different power balances, which we need to be very aware of in our interactions. And I think we also have very many different expectations. So I don't think we've cracked partnership yet, but I just wanted to give you an example of how we're trying to work with all our different partners in this study, and we've got a long way to go and a lot to learn. So thank you very much. I'd like to just acknowledge all the funders, the many organisations who are part of this, and particularly all the communities involved. Thank you.